The Dona Mountain Range of eastern Burma. This is a land of tremendous natural wealth. Precious stones, teak, farming, gas, and oil are second only to the rich collection of languages, religions, music, and other traditions that have for millennia defined this diverse cultural landscape. But for more than 50 years, the people of Burma have endured civil war at an enormous social cost. Since 1962, the people have faced a steady accumulation of oppressive policies under various forms of military dictatorship, most recently the State Peace and Development Council, or SPDC. The systematic denial of basic human rights, compounded with economic mismanagement and government complicity in a black market economy and illegal drug trade, has led to a deterioration of social infrastructure, most notably in the sectors of health and education. In the year 2000, the World Health Organization ranked Burma's health system the second lowest out of 191 countries. The following year, the SPDC spent over 40% of the national budget on the military and less than 3% on health. The population of Burma is now over 50 million, approximately one-third of which is ethnic minorities living primarily in rural areas. It is among these people that the oppressive policies of the SPDC are most widely felt. In an attempt to limit civilian support for armed resistance groups, the SPDC has instituted the Four Cuts policy, which is designed to restrict food, intelligence, funding, and recruits in ethnic minority regions. Land confiscation, forced relocation, forced displacement, forced labor, and extreme inflation each challenge basic food security, a right protected under the United Nations International Covenant on Economic, Social, and Cultural Rights. Major infrastructure projects such as logging, mining, dam construction, gas, and oil pipeline often lead to forced relocation and forced displacement. After people are forced to leave their villages, the areas are designated free fire zones, where SPDC troops are authorized to shoot on sight without provocation. Constructing roads, digging trenches, building bunkers, and portering are among the many other forms of forced labor reported in the region. Paddies and rice stores are simply confiscated or destroyed under the Four Cuts policy. There are indications that the Burmese military has instituted a policy of systematic rape in the ethnic areas. In 2002, the Shan Health Rights Foundation and the Shan Women's Action Network released a report entitled License to Rape, which documents 173 rapes and other forms of sexual violence committed by SPDC military personnel against Shan women. In 2007, the Karen Women's Organization released a report entitled State of Terror, which documents women suffering rape, murder, torture, and forced labor under the Burmese military regime in Karen State. Millions of Burmese people have become displaced. In refugee camps in Thailand, there are over 100,000 people, some of whom have been living there for over 20 years. Burma's neighboring countries host millions of displaced Burmese. In Thailand alone, there are over 2 million. Although neighboring countries host huge numbers of displaced Burmese people, there are still 600,000 to 1 million internally displaced people, or IDPs, still living in Burma, but forced to flee and hide within the borders of their own country because of the counter-insurgent strategies of the SPDC. Of all the displaced people from Burma, these people are the most vulnerable. No international humanitarian organizations can access this population. Those families displaced from their villages must find shelter in remote areas of the jungle. Poor health is a direct consequence of this instability, and the most vulnerable subpopulations are pregnant women, children, and the elderly. High rates of malaria, diarrhea, malnutrition, and vitamin A deficiency are directly correlated to this instability. The maternal mortality rates are some of the highest in the world. Out of every 12 women of reproductive age, 1 will die during pregnancy or childbirth in eastern Burma. Access to basic health care is a fundamental human right, one that must be protected. The Backpack Health Worker Team was formed in 1998 by health workers from Karen, Karenni, and Mon states with the aim of providing primary health care to the remote areas of Burma. There are currently 80 backpack teams comprising of over 300 health workers delivering a range of medical services and health promotion activities to a target population of over 160,000 people in Karen, Karenni, Mon, Shan, Chin, and Rakhine states. Team coordinators travel to neighboring countries every 6 months to restock their supplies. The contents of a 100-kilogram backpack are divided into 10 packages. Villagers help the medics carry the supplies back to their targeted area. Each team has a designated target area, and all team members are from the communities they work in. Working in these areas is impossible without familiarity with the terrain. 3 to 5 member teams walk thousands of kilometers to reach all the villages in their target areas. These regions include areas of armed conflict where access to health care is otherwise unavailable. The teams provide health care to displaced or vulnerable populations. Delivering services to an area of Burma where public health care is minimal or non-existent is a dangerous occupation. However, it is the only way to reduce some of the life-threatening risks that villagers face on a daily basis. Since 1998, 7 health workers and 1 traditional birth attendant have been killed by the SPDC or their landmines. Many more civilians have been killed. In the year 2008, 80 backpack teams treated more than 79,000 cases. Under the medical care program, the 4 major conditions treated are malaria, acute respiratory infection, diarrhea, and dysentery. In the most serious cases, patients are taken to the nearest mobile clinic, refugee camps along the border, or the Maital Clinic in Mae Sot, Thailand. The Backpack Health Worker Team conducted a survey in eastern Burma that found that almost 10% of pregnant women were forced to deliver in the jungle, and only 4% of women had access to emergency obstetric care. Within the same population, there were an estimated 1,200 maternal deaths per 100,000 live births. 30% of children died before reaching 5 years of age. About 15% of infants will not survive to reach their first birthday. The infant mortality rate is the highest of any country outside of Africa. In response to these shocking figures, the Backpack Health Worker Team developed a maternal and child health program. Under this initiative, medics coordinate traditional birth attendant training through local and regional workshops and assist with education, family planning, the promotion of breastfeeding, and immunization. By 2008, 580 traditional birth attendants attended workshops and received supplies to improve safe birthing practices, and traditional birth attendants delivered more than 3,000 babies. The Backpack Health Worker Team seeks to equip people with the skills and abilities necessary to manage and address their own health problems while working towards long-term sustainable development. In accordance with this vision, the team coordinates village health workshops where village leaders, teachers, healthcare workers, and members of local social organizations come together to identify the 6 most urgent health issues within the operational area and develop strategies to address these challenges. Every 6 months, Backpack team members from the different operating areas come together for planning sessions and meetings, which are designed to improve the programs and collect data for monitoring and evaluation. By 2008, over 400 village health volunteers are working with the Backpack Health Worker Team. The Backpack's Community Health Education and Prevention Program implement a 3-part public health promotion activity. First part is the School Health Promotion Program, which focuses on improving children's personal hygiene and access to safe water and sanitation at the school. The program in 2008 is being conducted in 254 schools, comprising over 15,000 students. The second is a nutrition program which distributes vitamin A and deworming medicines, provides villagers with information about the daily nutritional requirements of children, and helps to identify which foods within the community have higher nutritional value. The third health promotion program is water and sanitation, which educates villagers in the construction and maintenance of safe water supplies, mosquito minimization strategies, and covered sanitation systems. Backpack's survey found very strong evidence that human rights abuses are one of the main drivers of the health crisis in eastern Burma. Families who had been forced to flee their homes had double the chance of one of their children dying, triple the chance of their children being malnourished, and 4 times the chance of suffering a landmine injury. The Backpack Health Worker Team has made it a priority to generate awareness of health disparities within Burma to further pressure the SPDC to recognize the unfolding crisis. The Backpack Health Worker Team urges that the international community take action to combat the healthcare crisis and related human rights violations in Burma, and to address the crisis through the many community-based organizations working in affected areas. However, no amount of money or increased number of health experts can provide a sustainable solution until we tackle the root cause, lack of democratic rule in Burma. The Backpack Health Worker Team remains committed to providing the best health care possible to those displaced by civil war until a transition to democracy and sustainable development takes place in Burma.